Hello, everyone again. Thank you so much for joining us today. We are very happy to be hosting this really important conversation. My name is Inaudi Esposito. I'm the Executive Director for the Orange County Human Rights Commission. I use the pronouns she, her, and ella. The mission of the Orange County Human Rights Commission is to work towards bringing people together and provide education and awareness around issues affecting oppressed communities, especially during these times where our country is in turmoil over the Black lives unjustly and unnecessarily lost, like George Floyd's. The Commission is committed to continue to bring attention to issues like racism and help provide resources for healing and action. The events that have taken place in the last couple of weeks have been weighing heavy on us all, and we stand strongly in solidarity with our community as we advocate for equity for all. Today's forum, We're All in This Together, is a partnership between the Human Rights Commission and RECAP. And moderating with me today is my colleague and friend, RECAP's COO, Michelle McCune. Michelle, would you introduce yourself and the agency, please?
Absolutely. Inaudi, thank you for partnering with us to have this really wonderful conversation, especially with the lineup of panelists that we have assembled here. RECAP was established in 1965 as one of President Johnson's community action programs. We have been providing services to the community ever since then. We serve seniors, children, veterans, victims of domestic violence, those struggling with substance use disorder, those living with HIV and AIDS, and anyone really having trouble making ends meet. And we do that through our Head Start programs, our workforce development programs. We have residential and non-residential treatment facilities. We have weatherization and energy services. We have a parole reentry program. We do hopefully what is necessary to meet the needs of our community. And to echo Inaudi's statements, this has been a really difficult time for our nation, not just with the disease of COVID, but certainly the disease and the social issue of racism that has been unchecked and unexamined for far too long in this country. And we as a community action program, and we as part of this community recognize that without equity, there is no justice. Without justice, there is no peace. And we unreservedly and unapologetically say Black Lives Matter.
Thank you, Michelle. So just a little bit of housekeeping to get out of the way before we continue. This call or this forum is being recorded. Everybody is on mute. And also, we would like to point out that we have the chat box available and the Q&A box available. We will be moderating that Q&A and that chat box so that at the end of the call, around 3:15 or so, when the panelists have answered all of the questions, we can then get onto the questions that the participants may have. So if you look at the bottom of your screen, you will find either the Q&A or the chat box. You can enter your question there, and we'll be glad to ask it at the end, and we're hoping we can get to all of the questions by then. So now we're really excited to introduce to you, we're so excited to have an incredible diverse group of community leaders with us today. After some careful curating, Michelle and I agree that this group of folks represents the best of the best in our county, and we are very proud to work with them each and every day. So here today with us, we have Vanessa Green, community organizer and founder of Blackline; Doug Hovey, President and CEO of Independent Living; Ray Leonard, Executive Director and co-founder of the Newburgh LGBTQ Center; Anne Marie Maglione, Director of the Orange County Office for the Aging; Mark Sanchez Potter, Community Census Ambassador with Nobody Leaves Mid-Hudson; and Linda Muller, President and CEO of Cornerstone Family Healthcare. Welcome, and thank you each one for being here with us today.
And it would be wonderful, in particular to all of everyone listening, if each of our panelists could introduce themselves, just so everybody knows who the panelists are. Some are familiar, some are not as familiar. So Vanessa, if we could start with you, would you be kind enough to introduce yourself and the work that you've been doing?
Hi, my name is Vanessa Green. As they said, I'm the co-founder of Blackline. We began Blackline in 2016 when I was organizing in Newburgh, and the Blackline is, the mission of Blackline is to provide hope and promote social justice for individuals, families, and communities through immediate crisis counseling and collecting information on negative police, vigilante, and consumer contact in the United States of America. Blackline is a unique combination of professional staff, trained volunteers, and collaborative partnerships to create innovative response to pressing social needs and issues through an unapologetic Black, LGBTQ, and Black femme lens. And we, since COVID, we probably, the number of calls coming in probably has quadrupled since COVID-19. And then within the week of the murder of George Floyd, I would say that now there are 4 times as much as coming in. So we're providing this crisis counseling to folks who are feeling, most of the people calling in are Indigenous and Black. And we are fielding these calls and trying to alleviate people's anxiety and stress. Because I'm on the West Coast, I have an East Coast supervisor. I lived on the East Coast for my whole life. I have the resources from Orange County, from that area, from really the Hudson Valley, which I organize in. And I've been leading these folks to do these, to make sure they have these referrals that they need. And these are the programs and organizations that I trust. I contact Inati quite regularly. I know she's like, oh my God, I've been contacting her. I trust Michelle. Michelle is a trusted friend of mine as well. And I know for a fact that when I was in New York, we used Cornerstone to do the domestic violence program for men. So I know these are wonderful people on here. I know Anne-Marie for a very long time. So and Ray, forget it. She's just me. She's my partner. So this Blackline has really has helped a lot of people. A lot of calls we are getting, even if it's not just from the East Coast, is that Black people are not able to advocate when they go into medical treatment. We recommend that Black people, when you go for medical treatment, you have an advocate, because we know the disparities about how we're treated. And a lot of people are calling that when their friends are in crisis and they're not allowed to go in. So even under the COVID numbers, I'm just curious as to how many of us, because of the lack of care that we need, have died and it's been counted as COVID. That's been a big concern. I've been in dialogue with folks here in San Diego. I've been trying to get in dialogue with folks over in New York about, I get that COVID is dangerous. However, the treatment of Black folks has been so insidious that we need people to go to the hospital with us. That's just something that I recommend. Also, we're having folks who are, the education, I've gotten a few moms who've called who, because of the education that their kids are lacking, they don't have the tools and the necessary forethought to help their children through their education. I've had moms say they didn't even have the capacity to hug their child. So I'm working through how do we hold our children down, these Black children down, while we are in COVID. I mean, these moms are stressed out. They've hit their brick end if they have more than 2 children. So we're fielding calls like that saying, go in the bathroom, shut the door, let's breathe through it. And so, because we talk about the increase of DV, let's talk about the increase, and we don't want the increase of child welfare cases too. So it's so many different calls we're fielding. We're fielding hunger calls, we're fielding, and so I really appreciate when people send me resources, because I'm saying, well, go here. I'm calling people, can you get food to this person? So Blackline, I'm so proud of it because it really is a valuable tool for the entire country, really. But right now, we're stagnating on East and the West Coast. And I'm glad and I'm privileged to be invited to this webinar, because if COVID didn't come, I would have been traveling back and forth to New York, promoting and making sure that Blackline is really even in New York City, et cetera. So I thank you for allowing me to be here today.
And Vanessa, I just want to point out your shirt. The census is ongoing, and we want to make sure that all of our communities, our Black communities, our Latino communities are all counted. It is that important. So thank you for representing the census today. I'm sure Mark appreciates that as well, and he'll talk about it a little bit. Doug Hovey, do you want to introduce yourself and your organization next? Doug, you're on mute.
I was rambling on. I said before I introduce myself, I want to say thank you to both you and Inati. This could not be more important and more timely. And I'd be remiss if I didn't share that, like many of you, I've been extremely upset and disgusted about the tragic murders of George Floyd Ahmaud Arbery and Breonna Taylor, among so many others. And these are horrific crimes against humanity. And, you know, they reflect the social and societal racism that is all too prevalent and that must be addressed. So I will say, however, that I am encouraged by the organizing, the protesting, the uprising that's happening across the nation. I'm optimistic that we're going to see positive change. And we all know that's what all of our marginalized groups want to see, is peace in this country and acceptance of all people regardless of their differences. So I'm Doug Hovey. I'm president and CEO of Independent Living Incorporated. We were founded in 1987. We are a consumer-run organization that represents the interests of people with disabilities. I have a staff of about 100 people. Right now during COVID, I've got 80 people, amazing staff working remotely using various technology, like so many other organizations. And we have a crew of about 15 or 20 people who come to the office each day and keep all of our operations up and running. We also have a home care program that employs 700 employees who get up every day and go to the homes of elderly and disabled people to provide their care in the homes. And we've seen a significant increase in demand for the majority of our services. And like many of you, we're concerned about not only getting through this pandemic, but the aftermath. What's this going to look like in the aftermath? We're concerned about death from despair. We're concerned about substance use disorder, mental health issues, suicide, depression, and we want to be proactive and be prepared to respond to people when they need us. I like the title of this panel, We're All in This Together, and it speaks volumes of the community effort. And there was an eloquent post on Facebook a couple weeks ago. You may have seen, we're all in this together, but we're not in the same boat. And that could be not more true. I mean, there's tremendous disparities and inequities for various groups, including people with disabilities, people of color, Black Americans, Latinos, and the LGBTQ community, immigrants, and members of our aging community. And pertaining to our aging community, I know Anne Marie's going to be talking about a lot of issues, but I do have to talk about the nursing home crisis that we've been going through here in Orange County and around the state and around the country. Nursing homes are ground zero for COVID. If you think back to mid-February, which seems like it was 10 years ago, the first cases of COVID started in a nursing home in Washington State where 24 people were infected and many died. And by mid-March, several nursing home residents here in Orange County were infected and being sent to the hospitals and adding tremendous stress, not only on the nursing homes, but the hospital systems. And I must say, I have to give credit to the nursing home administrators because with limited resources and guidance from the state, they did an amazing job. They did the best that they possibly could to protect the safety of nursing home residents. And keep in mind that social distancing isn't possible when you depend on home care workers that come into your house every day or nursing home workers in nursing homes. The very thing that they need is the very thing that could also put them at risk. And that's workers coming in and out of their homes. So I've really been surprised at the lack of response by New York State. Nursing homes are regulated by the state. And for the governor to say that we regulate them, but we don't run them was not the right thing to say when we had mass infection rates and significant number of people in nursing homes dying. After the outbreak in February, the CDC was emphatic about the dangers of introducing COVID into nursing homes. In fact, on March 18th, the CDC said once COVID has infected a long-term care facility, it has the potential to result in high attack rates among our most vulnerable. 1 week after that, on March 25th, Governor Cuomo mandated that nursing homes accept COVID positive patients, and he barred nursing homes from requiring COVID tests from admission. This was like adding fuel to a burning fire. Again, the nursing homes administrators, they did the best that they could given the information that they had, but they just didn't know who was coming in with the virus and who was leaving with the virus. So at the end of March, we organized an effort, a statewide effort of 26 different state associations. We wrote a very strong letter to the governor's office. We had a Twitter storm advocacy effort, emails and telephone calls to the governor's office. And there were four main things that we were requesting of the governor relative to the nursing home crisis. One was that they provide adequate PPE to all nursing homes. Two was that they start testing all residents and staff at least once a week. My understanding is now that they're testing twice a week, which is a good thing. To create social distancing methods and enforce them. Not an easy thing to do in nursing homes, I get it, but we need to do everything we can to make that happen. And then the fourth thing was to track and publish data on a daily basis. We need to see the numbers. Our governor is very big on data, but we weren't seeing any data relative to what's happening in nursing homes. We finally got that situation resolved. But it wasn't until May that the state mandated that hospitals could no longer send COVID positive patients back to nursing homes until they tested negative, which was a good thing. The bottom line on this particular situation is senior citizens in nursing homes, they have no voice. They have limited protections from the virus, and they have no civil rights, and they're dying at an alarming rate in these institutions. Okay, so they need our voice. As for people with disabilities in the general population, they have worse outcomes on all key indicators of well-being. People with disabilities are disadvantaged in education, employment, healthcare, getting their basic needs met. Over 70% of people with disabilities are unemployed. It's obviously even higher now with COVID happening. And the unemployment rates among people with disabilities in the African-American community and the Latino communities are even higher than 70%. People with disabilities in other minority groups tend to work in jobs that put them at higher risk at exposure to COVID-19. There's a higher prevalence of disability among people who are Black and Latino. Only 68% of students with disabilities graduate from high school and get a diploma. And most diplomas for people with disabilities are special education diplomas. And imagine what education looks like today for students with disabilities during the COVID environment. They're really left out completely. 35% of people with disabilities are living below the federal poverty level, and the rates are even higher for people who are Black, and particularly for people who are Latino and non-English speaking. Persons with disabilities and chronic conditions are dying at a much higher rate from COVID. They're much more vulnerable, they're much more dependent, and they have no voice. People with disabilities who are Black and Latino are dying at even higher rates than white folks with disabilities, and this further emphasizes the racial disparities that exist. People with disabilities, and especially those who are Black and Latino, experience discrimination in healthcare and seek care when they're sicker. So what that means is they wait longer until they're desperate and have to seek healthcare. But
I'm going to have to put you on pause only because we have a limited bunch of time, and we can address a lot of the things you talked about in our question and answer period. And I want to get to Ray Leinert is the co-founder and executive director of the Newburgh LGBTQ Center, and we would love for you to introduce yourself and your organization.
Hi, my name is Ray. I use they, them, theirs, Black Unicorn, beloved, loved one pronouns. I am currently the executive director and co-founder of the Newburgh LGBTQ Center. We were founded in 2016 in response to a lack of resources in the Mid-Hudson Valley, and in particular because of the needs of low-income people of color, queer and trans people of color, not having an institution that we can go to that's trusted, and that actually centers us, our voices, and our needs, and our intersectional experiences living in the Mid-Hudson Valley. Oh God, Mark, I love your cat. We, as a group, we're operating out of donated space down at Atlas Studios with the Newburgh Community Photo Project. And since COVID has hit the community, we are not currently open to the public. We have transitioned all of our programs. 100% of our programs are now online to be able to better serve the community, including a queer relief fund that we created to give dollars to queer folks, and in particularly queer undocumented people that are not able to access resources at this time, and folks are poor and haven't been able to file their taxes and don't qualify for the stimulus. But I can talk a little bit more about our work in the question and answer section.
Thank you very much, Ray. And now I'm going to turn to Anne-Marie Maglione, Director of the Orange County Office of the Aging. Welcome.
Thank you. And thank you for having me on this really important panel. I'm thrilled to be on it. In a normal world, our mission is to advocate and assist older adults live independently with the best quality of life for as long as possible, and remain at home for as long as possible. And home can be a variety of things, whatever they feel comfortable with. And we do that through several programs, and we work with community members. Doug Hovey has one of his staff that's directly in our office. Doug and I work really closely together. Recap, I'll get to you later, Michelle. I mean, you do so much for us, and I'm always referring Cornerstone. So, you know, when we're talking about we're in this together, it's so true, because I look at everybody up there, and we all need each other to make this whole, and there's so much synergy here. And then March came and COVID came, and it directly affected the people that I serve, which is the 60 and older population. So at the time, we were serving 900 meals a day, probably have about 600 volunteers. Over 450 of them were over the age of 60. So we asked them to stay home because we needed them to socially distance. We needed them to stay healthy. This pandemic is really hitting older adults. So we opened it up to the community, and everyone pitched in because food insecurity was a huge, huge issue. And we needed to get people fed regardless of how we did it. Recap stepped up amazing. Our program would have collapsed without Recap, because we are now serving about 40% more people. And to do that in a matter of weeks without missing anybody, without dropping a ball, it took a lot of people and a lot of community support. So Michelle, I got to give you that reach, and I really appreciate that. But so the reason, one of the reasons COVID is hitting older adults more is they're vulnerable, and they have a lot of health issues because they're older. And, you know, as you age, your immune system can't kick in as well as everybody else's. So we were losing a lot of them. Then you add loneliness and isolation. That's a huge thing, because what happens when older adults who are vulnerable are left alone? There's 38 million people, I think, that don't have jobs and are collecting unemployment. But there's one group of people that are getting a paycheck the first of each month, and that's Social Security, and that's older adults. So scams and abuse have been just skyrocketing. We needed to address that. So we started a virtual coalition. I'm going to get into that further down the road. We have caregiving. Caregiving is the hardest thing you'll ever do in your life. We're all going to be caregivers at least once, if not more than that, in our life. Now you have no outside support. You have no respite. We needed to do something with that. We did some virtual support groups. We'll talk about that too. There's so many things that needed to be done. Now let's talk about race, Blacks and Latinos. So the population that I serve is more prone for getting COVID. Blacks and Latinos, Blacks are more prone to get it. So now an older Black person is certainly more prone. Now you have an older Black person that's maybe poor, or you have somebody that has that is undocumented. There's housing issues, there's sexual orientation issues. There's so many things that you're just layering on top and on top and on top. So I think I'm going to stop there so other people can talk and we can get into this further. But again, all of this takes community. And I want to thank you, Michelle and Addie, for doing this, because I think it's really important. And thanks for having me. I think you're on mute.
Somebody just won bingo. because there was a fire truck going by, so I didn't want it to be loud in the Zoom. So I'm going to introduce Mark Potter from Nobody Leaves Miss Hudson, and I believe he is the Census Ambassador.
Hi, everyone. My name is Mark Sanchez Potter. I'm the Community Census Ambassador for Nobody Leaves Mid-Hudson. So Nobody Leaves Mid-Hudson, we were founded in 2012, and since 2016, our mission has, our work has focused a lot on defending vulnerable communities. And one of the biggest communities that we serve is the Latino and the undocumented community. And so for the past 2 years, we've been working on municipal IDs. We've been working on the campaign to ensure driver licenses for everyone, regardless of immigration status, working in tandem with other organizations, to prevent the separation of families. And now because of COVID, we're doing a lot of work with mutual aid and ensuring that people continue to fill out the census. As we all know, the census is so crucial for funding for all of our programs, and especially our cities. I live in Newburgh, but all throughout the Hudson Valley, we need funding and federal dollars. So the undocumented community has been excluded, and we can talk about this more in the Q&A session, but they've been excluded from the CARES Act, and they will probably be excluded from all subsequent federal legislation. So people who are undocumented or who it's a mixed status household, they're not receiving benefits, they're not receiving any relief, and it's difficult. So now these people have to continue working or turn to nonprofit organizations for relief. And there's tons of issues, either with language or fear that their information will get shared with immigration. And so people are suffering alone because they're afraid. They don't want their families broken up, and it's sickening to think that there are people who are suffering alone because of this fear. And so we're trying to do as much as we can to alleviate that and work with different organizations to ensure that undocumented folks and all folks, regardless of immigration status or any of the identity, are able to get the relief that they need. And so.
Mark, thank you so much, and thank you for joining us today. And closing out our panel of introductions is Linda Muller, who is the President and CEO of Cornerstone Family Healthcare. Linda, welcome.
Thank you. I'd like to thank both RECAP, Michelle, and the Human Rights Commission and Audi for one more time showing us what leadership looks like and what leaders do. And thank you for bringing this panel together. To all the members of the panel, I am proud to share this time with you as our voices get heard, representing those that are most vulnerable. Cornerstone and RECAP share a history. We both came out of the civil rights movement. We both came out of a time of discord within our communities. We both came out to look at social justice and how it's delivered in communities that had been forgotten. We started in 1967, and we have a history with RECAP because you helped us when we started coming into Middletown. So our connection is long and strong. We started specifically around access and equality. Long ago, we knew that there was discrepancies between communities of color, communities with poverty, and access to quality comprehensive health care. Doctors didn't want to go into these communities. There was social unrest. There wasn't money to be made. There were difficult patients to manage. And so community health centers had its roots, started in 1965. We've changed over our 53 years. We started out as a migrant health program serving Orange County. And over time, we've become far more complicated as a business. We operate in 4 counties in Orange County, Rockland County, Ulster County, and Broome County. And what started as a small primary care practice has evolved over time as the needs of our communities has warranted us to change. So we provide pediatric and adolescent medicine, adult medicine, obstetrics and gynecology, dentistry, optometry, behavioral health, including psychiatric care for adults and for children. We run a comprehensive MET program inclusive of methadone and Suboxone and KSAC connections. We have cardiology, we have infectious disease, we have behavioral health connected to care management. Our focus and our aim has been singular since 1967, is to elevate the health status of our communities one patient at a time, and doing that with respect and dignity for all people. That is our job. That is what we've done. You've heard me say this 1,000 times, but I'll say it again. Healthcare is a right and not a privilege. It is something that every human being should expect and receive. It is difficult now in our world to be dealing with a pandemic. None of it's easy. All of it's been difficult. And then layer on top of that the civil unrest that we're seeing as a result of a murder of an innocent man. I know I grew up in the 60s, so I get it. I've had my time sitting on a picket line. I've had my time protesting, back then many things, but mostly around the Vietnam War. Never around the soldiers, but about the principles of the war. So we aren't changed a whole lot since the 60s. We still have our issues. We still have our voices who have not been heard. We still have our prejudice about what we believe to be right and not right. And by people coming together of all colors, of every part of our community, to talk about how we make systemic changes so that there is full equity, that there is full justice, and there is full joy in the differences that our communities have, is where we need to go. And I thank you for your leadership in letting that happen today.
Linda, thank you so much for your words, and thank you to all the panelists for joining us today. And each of you noticed the important timing of this conversation. And I think, you know, Inaudi and I, when we talked about what we were going to name it, you know, we're all in this together is the name. But if you notice, there's an asterisk. And that highlights the challenges for vulnerable communities, which all of you will be talking about. So Vanessa, I'm actually going to kind of give you the first question. And it is based on some statistics. And according to Johns Hopkins University, of an analysis of 26 states that have provided racial data about the virus, Black people make up 34% of COVID deaths, despite comprising just 13.4% of the population. Can you give us some thoughts on why Black folks died and were affected at higher rates than others? And how does racism and all of its intersectionality play a role in this?
Yeah, they like to say we have Black people have a higher pre-existing conditions, medical conditions, but I keep saying that's not pre-existing medical condition, that is white supremacy. We have a history of not being provided good care, quality care, even access to care. It's expensive. I like to say this, during the pandemic, I had a dental emergency, and I would like people to know that luckily my daughter, it cost me $3,000 to get whatever was done in my mouth. Who in the heck has $3,000? I didn't. So it's not pre-existing, it's white supremacy that made us have these pre-existing conditions. It's also about, you know, I'm gonna talk about the report on how George Floyd died, and it was like he had pre-existing conditions. No, he didn't. You know, because even with a pre-existing condition, if you didn't have your foot on his neck, he wouldn't have died. So it's about us understanding that, and it's also about, I think a lot of us have to understand that we don't have quality food. We have food apartheid in our communities. Not food desert, because desert is natural. It's food apartheid. It's created. It's man-made. We have stores that will go up in certain communities and close because they don't want to deal with those communities. We have our children who don't get the best of medical care as youth. Like I think about when I even went to the doctor as a youth. Hard to remember. So it's about that stuff that has happened to us as we are here, and then the impact of racism. Not going to the doctor, but then being dismissed by the doctors, being dismissive about how you feel, being dismissive about what you're reporting is not valid. So a lot of us, and people tell me that all the time, I don't go to the doctor because they don't listen. I don't do this because they don't listen. And so it's about when people say that people are voiceless, I don't believe any marginalized community is voiceless. I just believe who is listening to those voices. People are talking, but nobody is listening. So it saddens me that we are dying at such a disproportionate amount of rate. It saddens me of how many people are dying. It saddens me that those numbers are probably undercounted based on all the extenuating circumstances. So it's there, it's happening. And I also be real clear, because the CDC and Trump is listening to what he says, I believe the underreporting is on purpose. Like, you don't need to report that, you know. So we also, I get calls and people are suspect about what the CDC is saying. So it's for me, having good resources that when people don't trust the CDC, I can say, well, go to this site, because we have to have this information to protect ourselves. I'm constantly telling people, I don't care where you go, put a mask on. I don't care what you do, wash your hands, because even that little small steps might protect you, because we are so vulnerable. And I see so many, you know, I've been to a few rallies already, and I've seen some folks without masks, and I actually hand out masks, because y'all know how I do. Here's a mask, because no matter how we feel, no matter how we feel conspiracy theory, we need to survive this so that we never go back to the normal. The normal didn't work for us. It's not working for us. So we need to make sure that we don't go back to that normal. We need to be here to make sure that policies include marginalized communities. And I'm real clear that when you're making a policy and you don't have folks from the marginalized community who are not rich, who are poor, who have different abilities, who are from the LGBTQ, I would say trans Black women for that, then you're creating policies that are going to kill us. That you're creating policies that are going to kill us. The policy of not being able to go in that hospital, only one person, is killing us. It's killing us. The policy of curfew, the policies of shelter in place is killing us, because what happens is then you stick the police on us and they are hunting us because we're violating policies that we can't keep as Black people. If I'm houseless, I can't go to a shelter. I'm houseless. I can't. So it's those kind of policies that are impacting us. And so CDC, those numbers are probably underreported, but they're still too large for me. I also have numbers for Newburgh, by the way. Just want to put it out there because now I'm on the phone.
Go ahead.
From January to June, we had 688 calls. And I would say those calls became more, we got more of them when pandemic hit and then after George Floyd died. But in Newburgh, there was 329 calls. 200 of them were negative police contact, vigilante contact, and consumer contact. 129 of those calls were mental health, food pantries, housing, rally locations, dental assistant, daycare, loneliness, hunger, education for their children, no access, and securing medical care.
Wow.
And that was the Newburgh area.
Those are fantastic numbers. Vanessa, do you have numbers for Orange County as a whole?
No, I only pulled out Newburgh because now we had a conversation about something that happened in Newburgh. So I only pulled out because for me, Newburgh is a powder keg waiting to happen. Mm-hmm. So I know the next incident that takes place in Newburgh is going to burn down. Mm-hmm. And I just need people to understand that, because people are upset, they're frustrated, they're prideful, they're hopeful, and they're angry at the same time. So I've been collecting that data just for an outie so that we understand when it blows up, because it will, we're not going to be amazed at why it blew up.
Mm-hmm. I think you would have been really proud. The last two protests, one yesterday and one on Saturday, I think every single person had a mask. So I thought you would really appreciate that. Everybody had a mask, and if somebody came up and didn't have a mask, so they were handed a mask. So that is, also about community. So thank you very much, and thank you for being here.
Thank you so much for that, Vanessa. Doug, the next question comes over to you, and we can definitely continue the conversation that we started in your introduction. Like many other times, Americans with disabilities are largely left out of the US coronavirus conversation, despite, as we know, they're being uniquely affected by the disease. What does that actually look like? What challenges and barriers are people with disabilities met with during crisis? Don't forget to come off mute.
Thank you. Yeah, good question. A tough question. People with disabilities don't, unfortunately, have a strong collective voice. I think maybe it was stronger back in the 60s and 70s on the heels of the civil rights movement. We didn't have our civil rights legislation until 1990. That's the Americans with Disabilities Act that protects all people with disabilities in many, many different ways in our community. But not enough, I think, has been done to provide people with disabilities the guidance and support that they need during a pandemic like COVID-19. Or look at the hurricanes that we've experienced. I mean, we've just not been prepared for, whether it's Hurricane Katrina or Hurricane Irene or Hurricane Sandy. So many people were displaced, and so many people that were living in senior, beautiful communities were forced into nursing homes as a result of just not being prepared for these times and these types of crises. So it's really been a survival of the fittest in large measure, I think. And if you look beyond the institutions and the congregate care settings, there are millions of New Yorkers with disabilities that are trying to live in the community with limited access to resources. People are shut in their homes. They depend on their home care workers to show up every day, to get them out of bed, to get them bathed, to get them dressed. And when their home care workers don't show up, what happens? And we've had a number of calls from people in the community. Imagine what it's like to not be able to empty your bladder for 24 hours because my worker didn't show up, And we did have that situation happen, and we called the managed long-term care company, and the MLTC sympathized with us, and it was a Friday, and they said they could get a nurse out there on Monday. So we told them, no, it's much more serious than that. But, so there are a lot of people, I think, that are shut in. They're not getting their basic needs met during a crisis like this. I think many people feel like they've been left behind or left out. Containment measures like social distancing is very difficult, as I mentioned before, particularly when you're being cared for by workers who are coming in and out of your home. And you also have to consider the psychosocial impact of isolation. People are very, very depressed. We're seeing increased numbers. I mentioned that most of our services numbers are going up. We're getting more and more calls every day. The Orange County Crisis Call System Center their numbers are going up. It's a good thing we have the Crisis Call Center, because they are there to respond to people's needs and can triage to send out the appropriate supports to people in need. I think more people in the broad disability community need to know about that and need to utilize the Crisis Call Center. And then you've got people who are deaf, who don't receive communication the same way, or people who are blind that don't receive communication the same way that we do. So they're usually several days behind in understanding what's happening in the community and what the precautions need to look like. So they're often left in the dark during emergencies like this.
Doug, thank you, Doug. Ray, and we're going to turn to you. With your work with the lesbian, gay, bisexual, trans, queer, intersex, and asexual communities, could you tell us some experience they faced during this crisis, and where have you seen gaps in services in regard to COVID?
Yes. So I just really, again, want to thank you all for organizing this, and everybody in the panel today, and everybody who's participating by watching. The impact of COVID has been pretty intense. About half of my group of organizers has been infected with COVID. A number of our folks are volunteers and have been in frontline working positions, so working at grocery stores, working in restaurants before they were laid off. And what we've seen a lot of and have been tracking a lot of is people being impacted by not having employment. There's a huge lack of employment. Folks have been struggling to get access to unemployment. We have partnered with the Legal Services of the Hudson Valley to provide a Know Your Rights ongoing series that has happened in the first month of social distancing, and I guess I would use the term lockdown. And just making sure that every week people had access to that information, because we just kept either fielding messages or seeing things on people's social media, coming off of Twitter, coming off of Facebook, coming off of Instagram, about what was going to happen when the first of the month came around and there was no money for rent. And so that's been a really huge thing. Being able to get tested has been a huge barrier. The co-founder of the organization, Maria Ramirez, was able to get tested and also was able to secure an antibody test. I learned actually this morning, but other folks in my team who also live in Orange County and in Newburgh were not able to get that testing. So testing has been an issue for folks to be able to access consistently. A lot of people are dealing with issues of eviction, a lot of harassment from landlords. Again, going back to that Know Your Rights collaboration, so people know what their rights are, so they know how to mitigate the problems. But all of these things are basically surfacing those systemic issues that were always there and always existed well before COVID was ever at play, right? COVID, I feel like, has really helped maybe other people to develop the lens to see these kind of inequities, but this is exactly the kind of inequities that have always existed, and the reason why we started doing this work, right? The reason why supporting Blackline is important to us, because it's a resource for people to then be able to talk about these things, right? One thing I really wanted to raise is the names of Nina Pop and Tony McDade, who were both trans Black people who had their lives taken by the police in just the last week, right? So these kinds of the disparity is only compounding issues that our community was already facing. We already had higher rates of mental health issues. We already had higher rates of suicidal ideation, and also, unfortunately, successful attempts at suicide, right? And so because of these things, we have been figuring out how we're going to pivot, how we're going to shift as an institution to be able to address these needs and meet these needs as they continue to come up consistently again and again. I'm happy to say that a number of our folks have been able, after weeks and months of waiting to get through unemployment, are receiving unemployment. But again, there is a section of our population that's undocumented and is not going to access any of these kinds of resources, right? So as a group, we are working with really amazing funders who stepped up and helped us to be secure in a lot of ways. And so we took that funding and turned around and put it into a queer relief fund. So anybody who is queer identified, lesbian, gay, bisexual, transgendered, intersex, asexual, pansexual, is welcome to apply to this fund. We give out mini grants, so it's $50 to $200 at most. So we're able to give as much as we possibly can. For the amount of money that we've been able to raise, which is about $6,000 so far, it's not enough. It's not enough, right? And we are helping people to pay rent in slum type situations. And that's a piece that also impacts people in our community's health, is the environmental impact of living in housing that is substandard, that oftentimes has all different kinds of mold, including black mold, that is just, some places are just not even fit for human occupation, to be honest with you. And so we have been seeing a number of those things, in addition to an increase in policing in the community. So some of our folks, a group of young folks, got pulled over, but a couple of weeks ago were pulled out of the car, 5 cop cars, guns drawn. It was really quite a scary situation. We are connected with the ACLU and the New York Civil Liberties Union. So we have also been doing some internal development work with our group of folks to then be able to do and provide advocacy for people and make sure that they are able to get connected. Because the piece that Vanessa had raised before about advocacy when you go into institutions, it's something that we learned we had to do right away, and have been doing that advocacy, especially inside of medical institutions, because of the kinds of harm and violence that can happen if you are, in particular, a transgender, gender nonconforming, or non-binary person of color. And if you are one of those or all of those things, and you go in, particularly for mental health, the level of violence that we have fielded in just the past years has been tremendous. I can't even talk about some of these stories without crying. I can feel the emotion in my chest right now. But the need for advocacy and eyes in these institutions becomes crucial. And it becomes even more difficult, and the situation is exacerbated in COVID-19 when you are not allowed to be in the hospital, when you are not allowed to be there to advocate for a loved one, when you are not allowed to be there to witness what is going on, and also to speak truth to power. And in a lot of these instances, we can't call the police for support or for help because it is policing within the institution that is happening and is regulated within these institutions. So we've seen a number of folks, and we've connected folks to mutual aid networks that are dealing with food security issues. And we are grateful for those mutual aid networks and grateful for the work that is happening on the ground to make sure that people are able to get access to those things. We also recognized some of the gaps in those mutual aid networks and have hit the streets to give out PPE to people who weren't connected to those networks of folks. We also have been giving out safe sex supplies. We also have reached out to the community service of the Hudson Valley to get some training so we can also be able to do needle exchange work when the needle exchange van comes, and it comes once a week and they leave by 3 o'clock, right? And we recognize that our ability is different because we have folks that are on the ground, our folks that are in recovery, who see the need because they were living that life, and they can relate to folks because they know people. So they're out there talking to folks and doing this work, at least in City of Newburgh that it stands right now. So, that piece about we are a small percentage of the population, LGBTQ folks, and LGBTQ people of color are even a smaller percentage of that population, yet we see so much of the higher pieces of disparity. It doesn't make sense, but it does within the context of institutional and systemic racism.
Thank you so much, Ray. We really appreciate that information. Anne Marie, the next question is for you. So we started talking about it. I heard a little bit from you, and then I also heard a little bit from Doug about some of the challenges the seniors who are already so vulnerable face during this crisis. And we've known from the beginning that they're disproportionately affected by COVID. But can you tell us a little bit about, and a little bit more, because you started to, how things like stay-at-home orders, isolation, nursing and assisted living facilities are affected and impacted, but also can you talk a little bit more about what you started to mention, which is how are seniors who are already vulnerable, when you add the intersectionality of things like race, ethnicity, or socioeconomic status, when you add those intersectionality, how are they affected? Can you tell us a little bit more about that?
Yeah, sure. On a regular day, there's challenges that we have to deal with. Older population is the fastest growing population, and that continues to be the case. But yet they're often the ones that are not thought of. And, I have several reasons why I think that is, but I think, a major thing is they don't really advocate for themselves. They're like, you know what, if somebody else needs it, give it to them. That's what made them the greatest generation, is that they were willing to kind of go without so that other people could benefit. But you know what, now we're in this crisis where they are at target. So they're isolating, which is causing a lot of fear It's causing a lot of loneliness and depression and anxiety. Friends are dying. We get calls every day about somebody that's lost a loved one or a friend. Staff has lost parents. We've lost clients that have been on our program for a long time, which is then, you know, they've kind of become family. So then that my staff gets upset. It's a difficult thing trying to keep everybody safe and healthy. You add food insecurity on a normal day. Now you have this pandemic. Food insecurity has been a huge thing. Getting people nutrition, getting their prescription drugs, going grocery shopping for them. That again, it takes a whole team, and thankfully we have a community that helps us do that, that values and respects older adults. But as Vanessa said, having them go, if they have to go to a doctor's appointment, going by themselves. You know, we've had programs, how to be a smart patient prior to this. And we've said, you know, always bring somebody with you. Have a notebook, write down questions. Now they're going into a place with a mask and gloves and they're nervous and they're vulnerable. Now add somebody that is low income, has housing issues, whether it be poor environments. Ray had talked about mold. That's a big issue. They're living on Social Security, so they don't have a lot of money. Again, in a normal world, these are problematic. Now we're in a crisis situation, and it makes it even worse. And now they're alone, and they're isolated, and there's people that are scamming them. And the scams are really savvy. You know, Mark, I really want to talk to you. A lot center around the census. You know, there is a form that comes out. I saw my census form. It looked exactly the same. The only difference is on the bottom, there is a senior advisory committee, and they ask you to donate $10 to help elder adults not be scammed. And you can give us your credit card number, and you can give us your checking account routing number, and we're only going to take $10 from you. It's unbelievable. But because they're isolated, we don't always see them. So what we've started doing is we've started doing Elder Abuse Awareness Virtual Coalition. If you can't come to us, we're going to go to you. We say that elder abuse and scams are at epidemic rates. So now we're dealing with an epidemic during a pandemic. Awareness and education for us, really, we find is the key. So talking to them, reaching out to them. We can't see them every day, but we do friendly visitor calls. How are you doing? I have this lady that called me in the beginning of March because she needed some food. She now calls me once a week, and we talk for 10 minutes about nothing. But it makes her feel better because we're social people, and to not have that interaction is really so dangerous for older adults. Dementia starts to kick in, all kinds of issues start to happen. Like I said, caregiving is a big issue. Caregiving is the hardest thing you're ever going to have to do. Now you're doing it and you have no respite. And I cared for both my parents. My dad was a peach and my mom wasn't. And I did not have I had an outlet. So we are now doing support groups where there's this one lady, and she goes in her laundry room at 2:00 on Wednesday, and she has her call, and she said, this is what's keeping me going. You know, like I said, we have a great community. We tell everybody, check on your older adult, check on your neighbor, check on somebody. If you think something is going on, give us a call. Our single point of entry is our New York Connects number. It's 845-615-3710. If you suspect that there's some sort of elder abuse or there's a scam going on, Coladel Protective Services. It can be an anonymous thing. So if you're seeing something funny going on at your neighbor's house, err on the side of caution. Give us a call. Best case scenario, it's nothing. Worst case, it is something, but you know, we're going to be able to deal with it. That number is 845-291-2800. Also, we have WOGI, which is Welcome Orange Geriatric Initiative. Give us a call at New York Connects, 845-615-3710. It's so normal to be experiencing anxiety. It's so normal to feel depressed and to not know what's going on. And you just may need to talk to somebody, because we all know we're going to come out of this. And I am glass half full, and I think we are going to have a better, kinder world. And is there a reason we're going through this pandemic at the same time Mr. Floyd was murdered? Maybe there's a whole message that we got to burn everything to the ground so that everything can come up fresh and we can start new. That's what I hope. I hope there is more respect for older adults, because there isn't always respect for older adults. You know, there's been so many jokes that older adults are the target, and well, you know, that's how we weed them out. That's just horrendous. You know, we have to respect people. We have to respect everyone. So it's more difficult when you have, when you're dealing with someone that population is not always comfortable talking about their sexuality. So now you're talking about somebody that has been in the closet gay for so many years, but now they're coming out, and you add that anxiety and that fear onto them. And their family is going to know, because now they have to count on their family. There's so many different things. Blacks and Latinos, so difficult. Blacks are at a higher risk. They don't always have access to good medical treatment. And Cornerstone, I cannot say enough good things about you, Linda. You know, there was a time my daughter didn't have insurance, and she went to you, and the kindness and respect and professional way she was treated, I don't think I was ever treated that well anywhere, and I haven't been treated poorly, but I can't say enough about the gem you are to our community. So like I said, I'm fortunate to be taking care of older adults, but I'm more fortunate to have everybody as partners to help me, and I feel comfortable picking up the phone at any time, calling each of you and asking you for help, and I know that you'll give it to me. So thank you.
Thanks, Anne Marie. Michelle, you're on mute.
I know, I just got that. And that's why I'm on mute, because my doorbell rang. So, Anne Marie, just so you know, during your talk, you got a fist bump and some snaps about some of your comments. So well done. And we really, really appreciate your comments. So Mark Sanchez Potter, we're going to ask you to discuss the work you're doing next. And as the country provided financial resources to different communities in order to support them through these times, we know that the undocumented community does not have the same, if any, access to those resources. What are some of the barriers that you've been able to identify in your community? And what are undocumented folks doing to make ends meet and survive these times?
Yeah, so as I said earlier, undocumented folks, they were excluded from the stimulus, the package. They were excluded from the CARES Act. They cannot get unemployment if you do not have a social security number, if you are not legally working on the books, quote, you do not qualify for unemployment. So there's large gaps in these communities. And so what they'll have to do is they'll have to continue working wherever they are, be it if they're still able to work in the restaurant business as a line cook or something, where people are doing takeout, there are still undocumented folks who have to work there. Or if they work in farm work, they still have to go out to the fields and work apples and oranges, and they are not provided with PPE in a lot of these places because, they're paid either off the books or, or below a livable wage, and farmers and large corporations do not see a need to provide PPE to farm workers, as well as now that construction is allowed with the phase 1 reopening, you're going to see day laborers go back to work if they weren't working already. So people who are undocumented, they have to work, whatever job they have in order to survive, to provide for their families. And if there's a mixed status household where the parents are documented and or undocumented and the children are documented, that makes it even more difficult, because the children are entitled to food stamps, to SNAP, to all these programs. They're US citizens, but they have trouble accessing these programs because of that fear, because of the language barrier. They don't understand that their children are eligible for these programs, but that they cannot access them. So you're seeing a lack of that. What has been going on is different nonprofits and NGOs have stepped up to the plate. Nobody Leaves has partnered with the National Domestic Workers Alliance, which has a COVID-19 fund, and I believe it's $200-ish that people who were domestic workers, so child care, home care, they can apply for this, and they can get it. Pretty much everyone that has applied has gotten it, as well as One Fair Wage is another group that has as an emergency fund. People can apply for it, and it varies from $50 to $200. But again, a lot of them are one-time payments. People have been resorting to GoFundMes. In Newburgh, there was a GoFundMe set up by several women in the Latinx community who are community organizers, and they're trying to disseminate that funding to people. It's very difficult for undocumented folks to get this information and to get resources. So Nobody Leaves has really been trying to, and we've been connecting with different nonprofits, translating fact sheets, calling our members, making sure that they're okay, asking them what their needs are, as well as reminding them, getting back to me specifically, with the census work, that if you are undocumented, you can still fill out the census, and it's crucial for funding going down the road. So that's what we've been doing basically. Overall, I think that it has been impactful. I've seen people who have contacted the organization who say, I need money for insulin, or I need money for groceries, and our different organizers have gone out of their way. The other day I was in Middletown at one of the demonstrations, and we went back to the Middletown office, and somebody called and said, I don't have food, I'm in Monroe. And it took 2 hours, but one of our organizers got them groceries and delivered them to their front door. So we are attempting to alleviate that burden the best that we can.
Wonderful. Thank you so much, Mark. And we really appreciate you highlighting the fact that so many agencies have stepped up and have come to the answer of the question, how do we help and what do we do? So thank you for that. And we're actually going to talk a little bit more about that soon. Linda, this question is for you. And really to kind of help us wrap up, a lot of the things that have been talked about and mentioned are really talking about social inequities, right? And social determinants of health. Earlier, we gave a statistic that talked about how COVID is affecting Black lives. Another statistic that's been thrown around is the CDC has found Black folks account for 33% of COVID hospitalizations. And they say largely because of the high rates of chronic health conditions, which we addressed earlier on. But much less is discussed how food, class, and race have intersected in ways that perpetuate health disparities and social inequities. So can you talk to us about those high rates on chronic health conditions in the Black community and the Latino community and communities of color, and the role of social determinants of health?
Sure. Before I do that, I want to address Ray's concern about testing. Please know that testing is available and open. We've done 3 pop-up tests in the city of Newburgh. And if any of your colleagues, any of your constituents or friends are in need of an antibody test, or they're ill and need a COVID-19 test, 563-8000. There is no reason why someone should not get a test. There is no charge for COVID-19 that's covered under the CARES Act. And if somebody is uninsured or underinsured and there's difficulty paying for the antibody test, that's what your health center is here to do. So no one should feel that they could not get a test. We are absolutely open and available for everyone, documented, undocumented, it makes absolutely no difference. Anne Marie, thank you for that shout out. I hope if your daughter has insurance, I hope she's still coming to us, because not only do we take folks without insurance, but we take folks with insurance. So I'm hoping that she's still with us.
Yes, she is.
Specifically, the issues around the social determinants of health is we know what they are, right? It's inadequate housing, it is inadequate education, it is inadequate healthcare, and it is inadequate jobs within communities, and the inability to get quality food within communities. And so when you look at all those things that are in communities of poverty, which typically revolve around folks who are Black or brown, you can see the intersection on how healthcare becomes compromised. And so pre-existing conditions that are talked about with COVID-19, first of all, we all need to understand that COVID-19 is a novel virus. We've never seen it before. We've never seen it before it popped up in China. And there were no tests for it. There was no antivirals for it. You cannot cure COVID-19. You get it, and the goal is that you're going to be strong enough to fight the disease, the virus, and come out on the other side. So why is there a disproportionate share of people of color who die from COVID-19? The virus itself attacks small blood vessels. That's what it does. And where are the small blood vessels? In your lungs, in your kidneys, in your major organs. So if you have diabetes, diabetes is a disease of small blood vessels. If you have hypertension or heart disease, it is a disease of the small blood vessels. And so if you are not engaged in good healthcare, if you do not have good housing, if you do not have good nutrition, all the things that are necessary to have a strong, healthy body to fight off disease, then you are at risk for death. And we've seen higher numbers in communities of color that don't have a primary care provider attached in those communities. Sure, there's lots of doctors around. Vanessa already said it. She had to pay $3,000 to see a dentist. That is, I just want to say it, it's criminal. Should have never happened. That is beyond belief, but we have heard this time and again through the pandemic that certain providers of care have charged premiums for somebody to come in and be seen. If you're not my patient, then A, I won't see you, I won't take a new patient, or if you have no insurance, it's cash at the moment that we're gonna see you and it's full fare. That's not what happens when you have a community provider. Someone really explained to me the difference between a community health center and a for-profit, independently owned provider of care. People that have a financial investment in their organization, they're a partner, they're a stakeholder, there's something there. They're more transactional, right? It's all about how many numbers do you produce, how much revenue do you bring in, because your salary is tied to those resources. And so of course you're not going to take people in communities of color that may be underinsured or uninsured or are marginally employed and they don't have the resources to pay for that care. When you have a community health center, we're not transactional. We're a relationship provider of care. My doctors are not vested here from a financial standpoint. They get a salary. They're like I am. I don't own anything. We're owned by the communities that we serve. So our doctors build relationships with their patients. You don't work in a community health center if you want to make a lot of money. You don't work in a community health center if you don't want to develop a relationship with your patients, because we're just different, because we believe differently about how healthcare should be delivered. And so I think that we had a really good reaction to the total number of patients who were either in hospital or who succumbed to the virus and passed away, because we do control our patients who have diabetes. So their small blood vessels are not going to be affected the same way as somebody not engaged. Somebody with a hemoglobin A1C less than 7 in control is very different from a diabetic patient whose hemoglobin A1C is 12 or 14 or 18 or 20 because they're not engaged in care. Somebody whose blood pressure is in control is going to be affected by the virus differently than somebody whose blood pressure is 220 over 110. If you are not engaged in healthcare and you have these silent diseases, you don't really know you have hypertension until somebody takes your blood pressure. You don't really know you're a diabetic until it's too late. Until it's too late. You lose your eyesight, you lose your toes, you lose your extremities, you succumb to the virus. And so we can go on about the disparities between communities of color as opposed to those people who can afford to go where they want to go, get the care that they can afford to get. And what we do every day in our health center is ensure that we've leveled the playing field to keep people healthy. So we tested over 2,800 people. We managed more than 1,200 positive COVID cases. Out of those, we had less than 35 in the hospital, and we had less than 10 die. Why? Because we're a relationship health center. No one is turned away because they cannot afford to pay. No one is turned away because of who they love. No one is turned away because they're undocumented. No one is turned away because they're poor. No one is turned away, period. And there is the difference between a community health center who is engaged with the community and is part of the community, as opposed to a lovely building out on the outskirts of town. The community members who don't have a car can't get there, don't have a bus route that can't get there, but you can walk to us. And if you can't walk to us, we'll bring our mobile health van downtown on Broadway with my staff, and we'll test you right there. Because that's how you do this. If you're a community person, then you're a community person. It can't be lip service. It's got to be real. And we've been doing it for 53 years. No one gets turned away, period.
Thank you so much, Linda. That's actually an excellent segue to my next question. And it's really about how have we responded? So we have spent the first hour of this forum discussing, you know, the disparities and the challenges and the issues that communities that are vulnerable have faced. And you have just led us to ask the question of how have we responded? So this question is actually to all of the other panelists, since Linda has given us her responses. How did you respond? How have each of your programs responded, or your agencies, or what have you had to do outside of the box to address the disparities of specifically communities of color and vulnerable communities facing COVID-19? Doug, I would like to start with you because you're on my top left, and then I'll kind of go around my screen.
Sure, can you hear me?
I can.
Just want to make sure I'm not muted. So yeah, I mean, I think like many other organizations, we transformed ourselves practically overnight so that we could provide the bulk of our services remotely. So as I mentioned in my opening remarks, we have about 80 people who are working remotely and provide virtual forums and day-to-day connections with consumers throughout our region. And, you know, we also have 400 people with very significant disabilities in our consumer-directed home care program. And many of them require a daily check-in or a check-in every couple of days to make sure that they're okay. We implemented a system where we call people. We have a call list and a call chain, and all of our staff are involved with calling a certain number of people each day to check in on them to make sure that they're okay. And after 3 calls, if they don't answer, we do a door knock. We send somebody out to knock on their door. And depending upon their living situation, if they live in an apartment complex, if they don't answer the door, we'll literally get housekeeping or security to come and open that door and do a key in. And we have, in a few instances, found people on the floor, unconscious. Sadly, we've had a handful of losses, 5 to be exact. And that's pretty difficult on your employees when they have a relationship and they know these individuals and have worked with them for many years. We have 2 apartment complexes that we're responsible for a number of the individuals that live there. And keep in mind, you know, when people are social distancing, if they live in an apartment complex, they can't come out and socialize. So they're shut in, and oftentimes they live alone and they're not getting the same social interaction that many of us are able to get. And unfortunately, a lot of folks don't have the same degree of technology that we have. They don't have smartphones that enable them to, you know, do FaceTime and those types of visits. Now, that being said, we're fortunate that a lot of people do have technology, but we have to be mindful of those who don't and figure out other strategies to make sure that we're getting to them and supporting them and helping them to get their needs met, and to make sure that we're triaging them to care if that's what they need. If they need medical care, we want to make those connections. We've referred an awful lot of people to Cornerstone, as we always have, and have a great mutual referral system with them. We've also worked with, obviously, the local hospital system and worked with many people if they need to get to the hospital for whatever reason. But smartphones have become wonderful. Technology is wonderful for people who have it. So if we're not texting with people on a daily basis, we're talking to them on the phone, we're video conferencing with people. And I should also mention that for people who are deaf, and we have a number of people around the region that we support and provide advocacy and assistance to who are deaf, using a smartphone is the best methodology for them because they can see you. We can use interpreter services. We have Sorensen machines, which are video telephone systems. We have 2 of them here at the office, which we can use to interface with people who are deaf. And then there's the people in the blind community. You know, we want to make sure that they're not being left out. We work very closely with our state agency partners and our local county partners. We have the New York State Commission for the Blind, who's wonderful at doing outreach and supporting members of the community who are blind from, you know, early age until end of life. We also have partners with, obviously, the Orange County Department of Mental Health, a great organization there, and government unit that supports all of our efforts, as well as, you know, we work with them, of course. And many of you, we work together. And I think we have a tremendous opportunity when it comes to the rights and protecting the rights of vulnerable populations. You know, we look beyond representing just the disability community. We go beyond that and recognize that we're part of a much broader community when you think about all of the repressed and marginalized groups, people of color, LGBTQ, the aging community, and so on. And then we recognize that we're not exactly the same, but we're similar in so many ways because we face stigma, stereotype, marginalization, discrimination, repression, and persecution, oftentimes in many ways. And I think when we come together and realize that we have these common themes, you know, we're no longer the minority, right? If we come together, we're the majority. And, when I think
Thank you, Doug. Thank you. I want to be able to get to the rest of the panelists, but we really appreciate that message of coming together. Anne Marie, you're right underneath Doug here. So can you give us a quick, brief overview of what you've been doing and what you've had to do differently to address this disproportionality?
Yeah, we've actually changed things quite a bit. We've kind of been in crisis mode. So where we offered different programs, we put those aside and we just dealt with basic needs. So that is food insecurity. That was our number one. Making sure people got their prescription drugs, making sure that their health insurance was in place. People had issues with that, so we helped with that. Caregiving, we started doing virtual calls. We started doing the elder abuse is a huge, huge thing. We started doing, each week we're doing a YouTube on a different topic about elder abuse. And, you know, for we have a lot of older adults that are tech savvy, but we have a lot that are not. So when they are not, we send them flyers. We send them flyers with their meals that they get, and it's on a variety of topics. We do a Zoom lunch with our dietitian, and she talks about different things. If you can't, again, if you're not tech savvy and you can't do that, we send a flyer so that they know what that is. Social determinants of health are really, really important, and we take that seriously, because more than likely congregate sites are not going to be open, and senior centers are not going to be open for anywhere in the near future, at least not this summer, maybe into the fall, but we don't know. We don't know if and when the second wave is going to come. We don't know what it's going to look like. So we realize we have to do some different things. So we're starting a parking lot bingo, and we're going to be doing it at the Arboretum, and it's going to be invite only, social distancing. They're going to get a boxed lunch. So they won't be next to each other. I mean, they'll be able to talk, but they'll still be far away. We're handing out PPEs. We're delivering them all the time. You know, Michelle, like I said, Recap has helped us out in not breaking the system that we have, which is a very good system, and they've been helping us deliver meals. But you know what? They've gone above and beyond. They gave flowers at Christmas, at Easter. Really good call, Michelle. I wish I had done that, but that's a really good call. I can't tell you how many phone calls I got of people that just loved the little hyacinth that they got. It wasn't a big deal, but it made a huge, huge difference. And this week we're starting a virtual book club, which again, as Michelle will tell you, I have been trying to get into for about 15 years. I now have to do my own with older adults, which I'm going to be doing. And we've told them a book to read, and we're going to start talking about it. So that's just keeping them together, kind of dealing with the isolation, letting them know that we're going to get through this, that we're here. So those are kind of some of the things.
Awesome. Thank you so much. Mark, is there anything that you haven't shared with us yet that Nobody Leaves with Hudson is working on or doing differently? I know you shared a lot about the relationships with other agencies. Anything else you'd like to add?
Well, overnight we had to change to become virtual because we couldn't hold meetings anymore. So we had to conduct virtual meetings, phone calls with members, community members, and anyone that needed the services. We partnered with different organizations to ensure that, you know, members who were undocumented did get food. I know in Kingston, they did, in the first couple weeks of the pandemic, they did make a lot of meals and distribute it to members and other people that needed it. We have been delivering PPE to people. We also brought it to the demonstrations that we were at in Middletown and Newburgh. I mean, again, it's the coordination and seeing where we can fill in translation services. Basically anything to either support our members and people who are undocumented or who have a language barrier. Just anything that we can do basically is what we're attempting to do.
Thanks so much. Appreciate that. Vanessa, is there anything you'd like to add? I know you shared how the numbers have gone up. Is there anything else you'd like to add about the work that you're doing during these times?
We have, I've started virtual training for organizers. There's a big push. There's a lot of young people, and I'm so happy. Old people need to get the hell out the a lot of young people are doing these rallies. The one in Mount Vernon, in Yonkers, I helped the young girl organize, which came out okay. So I've been doing that. We started Black Women Deserve here in San Diego, which is totally a funding. If you need anything, there's no questions asked about how much. We don't have a cap limit. And there's a mutual aid fund called We All We Got, which is very specific to the Black and Indigenous and Black immigrants here in San Diego. I live in that community with Black immigrants. So we started that. And we also are doing a caravan. So we're doing stuff, and Blackline is kind of not leading it, but the hub, like where people can call in and ask questions, people can call in and say, who do I call for food? Because who do I call for? I need diapers. Who do I call for? I need adult diapers. So we're making sure, and we have allies on the ground who deliver. I just want to say this, that a PR brand is not action. I want people to ask, what is your corporation agency doing to ensure Black lives do matter? What does your leadership look like? What does your board reflect the community you claim to serve? Because we are not going to go back to normal. And in order for normal, we're going to have to redo some crap and make sure it's looking like the folks who are most impacted in this country by white supremacy.
Wonderful. Thank you, Vanessa. Appreciate those closing words as well. Ray, anything you'd like to add as well about, I know you've also mentioned some of the funding and some of the things, but is there anything that you'd like to add?
Yeah, just that at this moment, the same way that Vanessa is supporting folks doing organizing, we are also supporting folks on the ground doing organizing and standing up and standing into their power and activating a new generation of young people who are stepping up and stepping into their power. So for us, it's really about being able to pass the torch on to other folks, because the reality is that these things are burning, and I feel like Anne Marie said it in such an eloquent way, and I was definitely snapping when you talked about it, because, and I know Vanessa knows this, but I don't see this as an opportunity for us to go back to business as usual, because business as usual is killing us. So if you have an interest or a need and you want to learn more, hire us. We do anti-racist education. We do intersectional LGBTQ anti-racist education. We will work with you and develop your leadership. We will work with you and your institution to create actual plans and strategic plans to implement within your institutions. So we are here as a resource for that. We will continue to support and promote the work of other organizations that are doing work in solidarity with Black and Indigenous populations. That's all I really have to say. Thank you all so much for this work and this thought and the thought labor that went into this process, and everybody for being here. It's great to see your faces, because when I do see your faces, it's usually like this. That's the part of the new reality, right? I'm immune compromised. I can't be out as much. I want to be out in the street, but I can't, because if I get sick and I come home and bring it home to my partner can die. So these are like real tensions to figure out at this moment, is how are we going to do the things that we know so well? I think a friend of mine said today that my love language is being out in the street protesting. And so was mine, except I can't, because things have changed for me. And I have to live with that and figure out how to be productive and deal with some of the guilt that I have about not being able to be out in the street. And that kind of sucks, right? Like, I'm now living with disability. Things have changed for me. And that's new as somebody who didn't have to deal with that. And so I'm learning a lot, especially from disability activists and the Black and brown queer community, who have put out a lot of work. And a lot of the mutual aid networks come from their thought labor. So there's an organization, it's called Sins Invalid. I would recommend looking into them for additional resources. They have a lot of work coming out just in this month, because it's Pride. So Sins Invalid, take a look at their work and see what it is that they're doing to build power and voice for disabled, queer, and trans LGBTQ folks.
Right, would you
Wonderful.
be able to put that into the chat so everybody can look at them? And Linda, I know you wanted to talk a little bit about what you're doing in Middletown. You're on mute.
Sorry. Yes, we're doing pop-up all-day COVID-19 and antibody testing on tomorrow, on the 4th, the 9th, and the 11th at Thrall Park. 563-8000. Please call to schedule your time to be seen. And just two other things. For any of you that are dealing with our undocumented community, the legislation around public charge has caused many people to be afraid to come in and get care. They're worried that they're going to get deported. They're worried that somebody's going to call immigration. They're worried that their status towards becoming a citizen will be jeopardized. No, it won't. Come to the doctor. It's safe. I just want to close, if I could. I told you that I was a product of the 60s, and one of the greatest civil rights leader was killed for his belief about his dream. A man of integrity who believed that all people were created in the image of God and all people were created equal. Martin Luther King. taken from us because of his beliefs. But there is something that drives me every day. And he said, in all the forms of inequity and injustice around healthcare is the most shocking and inhumane thing that we can do to each other. Let us all remember that we are from the same fabric, and that all of us that are sitting here on this panel care deeply about our communities. We care deeply about our brothers and our sisters. And our goal at My Health Center is to ensure that you all of us, regardless of who you are comfortable in getting the care that you need. Our goal is to give you good quality care so that you can live. And isn't that what all of us want? A chance to be healthy.
Thank you so much, Linda. That was beautiful. That was a perfect way of closing our panel. We're not done yet. We have some questions to answer, but thank you. I appreciate that. And also want to take the opportunity to plug in that is the only local urgent care that I go to for myself and my children. Just want you to know that. Absolutely. Love your staff there. And I never have to drop a name. I'm always waiting to say something like, I know Linda Muller. I never have to. They always
I hope you should never have to. And
never have
don't
to.
forget we habla español, so make
correct.
sure that everybody knows that we do both.
That is absolutely correct.
And about 9 other languages too, so.
So we have a few questions that we want to, before we wrap up, we have 3 questions that we want to get to. So 2 of them I can get out really quickly because the first is, will this webinar recorder be emailed? The webinar is being recorded and will be provided via link and through the Orange County website and the Human Rights website and the RECAP website. So not only will you all get that link, but we are also asking that you please share it. You will also, another question was asked, will we get the contact information for the panelists and their agencies? You will absolutely get that as well in that email. So thank you for those questions. The first question, Linda, is actually for you. I can just get to it. Hold on 1 second. No, that question I have on my cell phone. Hold on, I have multiple things here. And it is around testing. Linda, the question is, what is still the problem in accessing rapid testing and antibody testing?
Okay, so we don't do rapid testing. The efficacy of most rapid tests is not high. So we're using nasal swabs still for patients who are testing for active virus, which is the COVID-19 test. That's the one where a swab goes in your nose, short of hitting your brain, got to go in deep, take the sample, and then send it to the lab. The antibody testing is done with blood drops, either venous or finger. That antibody test is 100% accurate. Many of the rapid tests have a failure rate of somewhere between 40 and 60%. So until there's a test that we can put the efficacy behind, we're going to continue doing the tests that we know have the best results. 24 to 48 hours is how long the test results come back. But once you have your test results, you can be assured that the diagnosis is correct.
Perfect. Thank you so much. The next question is for anybody who does have this available. People want to know, how can they get involved? Do you have volunteer opportunities? And any one of the panelists who does have volunteer opportunities?
Yes. We have lots of volunteer opportunities. Like I said, 80% of our meals we deliver are volunteers. So we always need volunteers. If you give us a call at Office for the Aging, 845-615-3700, I will call you back directly. Variety of things. We have people that work 1 day a month for 2 hours, and we have a lady that when I first started working, I thought she was actually an employee because she works 5 days a week in our office. So whatever you want, we will work around you.
Wonderful. Does anybody else have volunteer opportunities they would like to highlight?
Blackline is all volunteer-based. All of this is volunteer-based, but we're specifically training folks who have an impression analysis. You can't do this work if you don't have an impression analysis. So most of the folks have taken on doing racism more than twice, and they understand. So if folks have some kind of some bit of analysis around oppression and the impact and the anti-Blackness that permeates in this country, email me if you put it up. Just email me.
Perfect, thank you. Anyone else have a volunteer opportunity they'd like to share? Okay, we're going to move on to the next question, and this is for anyone who has some suggestions. The question is, the public library will be opening up in phases over the next few weeks, gradually working toward enabling people to connect inside the building. What are the top 5 things you would like to see us offer, do, provide to best assist the most urgent needs of our community at this time? How can our space be there in the most needed ways to serve all members of our community at this time?
I'll go first, I guess. Very, very briefly. I guess use of computers to do electronic census, only because we've been calling people and they say, oh yeah, we've done it in the mail, or we want to do it online, but we don't have a computer, or or it's a landline. It's and you can do it on the phone. But people seem to want to do their census on the computer. So I think that having that, and I know that we did have that in Newburgh before this started. There was a dedicated spot in the Newburgh Public Library for census work, but once this happened, it couldn't be available. So I think that would be very important.
Thank you.
The same thing with the computers. We do telemedicine and telephonic type of visits, but not everyone has a computer access or have internet access. And so if someone is afraid or unsure whether they can come out of their house yet, we can still see you, and being able to open up that computer line so that a physician, a nurse practitioner can face-to-face with a patient would be most welcome.
Wonderful, thank you. Anyone else want to add anything that they think could be helpful and how to help the community with the library system?
I think, and I've talked to Mary Lou directly about this, is to make sure they have PPE. So if they have extra masks to give out, so I'm sitting in my office right now, and you've seen me get up and down because people are coming to our door asking for masks. So masks and individual hand sanitizers are huge for our community. So if we can make those available in as many places as possible, you cannot have too many masks.
Awesome.
So I have a quick question, if I may. Is anyone coordinating peaceful protests in support of Black Lives Matter?
There's been 3 already just in the city of Newburgh.
Right.
There's been one in Monroe, there's been Poughkeepsie, there's been Kingston. They're all over social media.
There's one in Goshen this Friday.
Yep.
And I believe the last count I got was there have been 18 planned for this week alone.
Yep.
So, yeah.
And they've been wonderful.
18.
There are 2 happening on Sunday. There's a sit happening and a prayer happening down at the People's Park. And then afterwards, Black youth are leading a march, rally, and teach-in in front of City Hall heading to Downing Park. And we're helping to support that. And then last Sunday, with the Black Lives Matter Network, I convened a group of between 250 and 300 people in Poughkeepsie through a platform that we're calling Congregation. And we're using it as an opportunity to build deeper relationships with people so we can actually do some strategizing, because the marches are important, the rallies are important. And then what happens is that people march and they rally and they go back home and they don't get involved in systemic change. And so we saw this as an opportunity to start to build out some more infrastructure for how to address these issues. I saw Mark there wearing a mask. And we'll be working with that group of young Black folks to bring Congregation to Newburgh and to other places in the Mid-Hudson Valley to be a more stronger, resilient network to really dive in deeper on how we're going to do this and working with everyone. We need to work with everybody.
I would also say if you have some Black leadership to do, we did a Black healing space virtual. We had over 500 people from San Diego calling to we did some pod mapping, and then we did let people talk about how they were feeling. So, and it was really, people kept thanking us for the space at least. I know everybody doesn't have broadband, so that can be sometimes hard, but I just think that there are some folks who can get on those virtual meetings and talk about healing and what that looks like in our community. So I definitely would say that's one of the things. Also, I get folks plan these rallies, and I get the white allies in Orange County who send me the hate. And then I send it to her now, and she goes, oh shit, I don't know what to do with that. So
And then I send it back to you and say, Vanessa, what do I do with that?
yeah, so please, when you're organizing, make sure you have a nice amount of folks that those coward protesters don't upset and cause violence and instigate. But some of the stuff that I'm not surprised because I lived in Orange County, raised my kids there, and I know what I went through. Some of the stuff that people post about what they're going to do is sickening. The dehumanizing of Black people is I'm glad I'm gone, but then San Diego's no different. So it's quite hurtful and triggering when people send me the hate. Well, we're going to teach those monkeys that they shouldn't be here. So I get the back end of these great rallies of the hate that is still permeating within Orange County, New York.
Yeah. Actually, Vanessa, it was just one of those messages was just picked up by the Record, and they featured it today out of Warwick. So something completely different, but it was shown the threats that were being sent out on one of the Warwick pages in response to a peaceful protest. So yeah. Awesome. There is one more question before we finish. A participant wants to know, what can people do if confronted by anyone, a service provider who is not following guidelines of social distancing, not wearing a mask, who is challenging and labeling a high-risk person concerned about getting COVID? So what can someone do if confronted by anyone, a service provider who is not following guidelines of social distancing, not wearing a mask, who is challenging and labeling a high-risk person concerned about getting COVID? Would anybody like to?
You know, I've told the folks that I serve that you absolutely have the right to say, please wear a mask. And if they give you a hard time, give me a call, because I have no problem calling them and talking to them.
We've done the same thing. We've empowered our clients to either advocate for themselves or work with our staff to help advocate. Or again, you know, if it comes to me, I have also no problem making a phone call on behalf of whoever needs it. If there are people who are not social distancing, not wearing masks and gloves in a service provision, that's problematic. And the health department is also a resource.
Yeah, wonderful. Thank you so much. And to wrap up with that question, I believe the governor has put out an order that all businesses have to, or have the right to refuse entry into a business. I think within our groups, it's important to make sure that if someone isn't wearing a mask, we ask, do you need a mask, right? So maybe have some in hand to make sure that we are, you know, providing the masks if that is the issue, on why they're not wearing one. But this really does bring us to the end of our program. It has been an incredible couple of hours. We thank each panelist deeply for your sentiments, for the thoughts that you shared and your expertise, but really also for the incredible work each and every single one of you are doing. For many of us, this work isn't just when it's trendy or when there is a, you know, horrific incident that occurs and, you know, we wake up. No, for all of us on this call, this work is 365 days of the year, and I'm very proud to share this space with you all. For all the participants who joined us, thank you so much for being here. Again, I will share that link with you. Give me a couple of days, but you will all have it, and it will be up on the Orange County Gov website. And really, just thank you so much for being here. We will have the information for contacts sent out, but really, we hope that you are all well, and thank you again for coming. So,
Thank you.
thank you.
Bye.
Bye, everybody.